back to the Clinical Breakroom Podcast. I am one of your hosts, Will Kirkpatrick, and today I had the pleasure of being interviewed by Ava with NursiConnect. It is a virtual nursing staffing agency. So virtual nursing is a super new thing. It's very cool because you still get to be involved with the clinical aspect in the hospital, but you're actually working from home. So it's a very cool career to learn about. So I hope you guys enjoy this episode.
Welcome to the NursiConnect podcast. My name is Ava. I'm the chief executive and founder here for the remote nurse staffing agency, NursiConnect. And on the NursiConnect podcast, we talk about all things remote nursing. Okay, today we're just going to talk about nurses that are able to work from home and to create kind of a remote lifestyle for themselves. So today I have on the show Mr. William Kirkpatrick. You might have seen him on TikTok. I call him the VR guy. I don't know what anybody calls him. I call him the VR guy, but I'm gonna let him introduce himself. Welcome to the show, William.
Thank you so much, Ava. So yes, my name is Will Kirkpatrick. So I'm kind of a hybrid of all kinds of things, but my domain is nursing education. So just a little bit of background about me. Clinically, I've been a nurse for 4 years, and most of that bedside experience has been in the ED and ICU, and then got into education in 2021 and started a virtual reality nursing education company, and then grew a nursing education team around me, and then grew a software programming team around me to make virtual reality simulations for nurses to use. And for college, our main customer that we talk to is nursing schools, but then we also opened it up to individual nurses too. So that's just a little bit about me, and I'm excited to be on this show with another nurse who works from home. And it's kind of cool to see, that nurses that are using their licenses in a completely different way than like the traditional way. So I'm excited to kind of dive deep into how our lives kind of go with working from home.
Yes, so excited. William, I really love your company, your brand, what you're doing. Like, that is fire to me. I love nurse entrepreneurship. It's fire. So that's why I called you the VR guy, because I don't think anybody's really doing what you're doing. I see some people try to one or two people try to attempt it, but I haven't really seen it that much. So
yeah,
kudos to you. I love it.
Thank you.
Okay, so I guess you can go first. You want to talk about like the day in a life, like kind of what you do working from home as a nurse?
Sure. Yeah. So typical day for me is so my position with the company itself. So I founded the company in 2021, and at first when you start a company, just like every small business, you're pretty much wearing all the hats. So I did software development, so had a background in that. Did created the product with my hands. Then of course quickly grew that, because just like nursing, there's specialties in software development. Some people are good at design, and some people are good at functionality. My skill set was more of just like design and everything like that. So I wasn't great at actually programming functionality. So that I was doing that. I was building curriculum for the simulations for nursing schools to use. So that was pretty much the full first year or two. That was my life, is constantly working from home. And I was still working PRN at the hospital at the bedside at that time, just because, of course, running off of no funds. This is just like stage one, like working, getting an actual product out there. And then work from home. I mean, I would try to do every 8 hours straight of just, building simulations. Then at night I would be up at, working on building the curriculum around it. So everything like that. But now today I have a team around me. So a typical day for me is I do work from home still, but I do travel more to institutions. So any school that, partners with us, I'll travel to the school. And then get to meet the faculty there, and also get to meet the students, because we try to also help colleges implement the technology, because it's so brand new to people and very foreign. Because even if you're tech savvy, virtual reality is still kind of a very brand new thing for a lot of people. So we go there and install the software on the headsets and orient all the students and orient all the faculty there. So that's pretty much my day to day. I'll just have virtual meetings most of the time, and then I'll travel when I need to. So, and then have meetings internally with our company to make sure our projects are on time too. So that's my day to day. Nothing clinically anymore, which I do miss it a little bit. So I'm excited to kind of dive into because yours is still clinical, but it's so virtual too. It's work from home clinicals. So it's cool.
Yeah, I was just about to ask you, how do you maintain licensure? When it comes down for licensure renewal, how do you get your time and your CEs and everything?
Yeah, that's a good question. So I haven't been doing it long enough where I had to worry about that. So I just renewed like last year.
Oh,
So I was still working at the
got
bedside,
you.
not too long ago. I think I stopped working at the bedside last year in June. So it's almost been an entire year now. So I've been working from home completely since then. But what my plan is I do CU courses. So you do get CU credits for doing CU courses for nursing. So that's kind of and I have my NP license too. So I am PRN with being an FNP. So I can work at the clinic anytime I want, depending on, so I keep my hours like, at the clinic with that too. So that's the plan anyways. We'll see.
Yeah.
I'm sure it'll be not as easy as it used to be.
Yeah, I bet as your business is growing and you're getting to in contact with more nursing schools, you're probably gonna have to do more education on the technology. Like it's gonna keep growing because
Yeah.
it just is. It just is. Um,
Yeah.
okay, I guess we can get into a little bit what I do working from home. And I think I really love what you do because it kind of leaks into virtual nursing to me, or I love the innovation that surrounds nursing. So I guess I'll
Yeah.
talk a little bit about what I do working remotely as a nurse. And I'll preface it by saying I absolutely love it. I enjoy it. That's why I created NursiConnect. But so what I do is called inpatient virtual nursing. Okay, this works because the patients, they all have cameras on top of their TVs in their hospital rooms. Okay, so with that being said, that's how all the care is delivered virtually. So the virtual nurse is responsible for things like the admission, the discharge, they'll do clinical rounding. They'll be the medication sign off nurse. You know how you need to sign off for certain things. You can call the virtual nurse for that. Um, they'll also do patient education and they'll also be able to mentor nurses on the unit for like their clinical expertise. Those are like the 6 essential functions of the virtual nurse. So, also with that being said, the whole idea of virtual nursing is to support the bedside nurse kind of in a different way. Just to having another nurse do all of what they call the administrative tasks, the heavy documentation that surrounds nursing. While the EMR was something we saw as like a way to make documenting our patients easier, it's kind of become very cumbersome. Like we spend a lot of time in the EMR, like more than we do with our patients. So bringing in another nurse who's solely, we're splitting our time between the EMR and the patients, but trying to help the bedside nurse kind of reclaim their time back with the patients at the bedside while we do all the heavy documentation. So virtual nurses, they work 12-hour shifts because they're solely there available for the bedside nurse. So there's day shift and night shift virtual nurses. Work 3 days a week. That's like my favorite part of it. I absolutely love working 3 days a week. And as far as the pay and everything, it's very similar to bedside nursing. I think it was like a couple dollars different, maybe $2 or $3 different. But not a big change where I was like, oh no, I can't make the switch. But yeah, that's kind of what inpatient virtual nursing is. That's like the gist of it. And the plan and the goal is to put virtual nurses on every unit and every hospital everywhere. Like right now, it's just being piloted on like high turnover units like med-surg and a little bit of ICU and in the ER. But they want to put this everywhere. And I think it's a great idea. I absolutely love it. I enjoy it because during the pandemic, I was working at the bedside. I was like, this is not sustainable. I don't know how anybody can do this for more than 10 or 20 years. Like when you think about your career, but working at the bedside, I was like, that's not realistic for me. And I don't think it's realistic for a lot of nurses, but virtual nursing, adding that component, we might be able to keep some nurses at the bedside with that. So that's what I do fully remote. I don't go in ever. And I love it. That's exactly what I do working from home.
Yeah.
Oh, go ahead.
I was just going to comment, like, just thinking about, working from home in general has just been getting so popular since COVID. And like, just the fact that you can think of a nurse who, if this didn't exist, nurses would be leaving the bedside at, the rate there still are. And they would just go into a completely different profession. And what you just mentioned and what you highlighted is that, you had the experience where, it just wasn't for you. It's not for a lot of people, unfortunately. And it wasn't for you, but you were able to get into another, field of nursing and still do clinical things of nursing and work from home from that. And this part of that career basically saved the nursing workforce because I can see why some people would probably say like, oh, this is going to be terrible for nursing because everyone's going to want to work from home. But at the same time, this is not the type of nurses who like, yeah, I mean, I'm sure it's interesting to them. And, there's going to be probably more that are interested in doing virtual nursing eventually when this becomes a really popular thing. But these are the nurses that, I mean, you're going to lose them if you don't have something like this. I mean, you better at least, have them available at a capacity of like being virtual, because if you didn't have that, then what are you going to have now? Nothing. So it's just going to be,
exactly. And speak to your point about like nurses leaving to do virtual nursing. That was like one of the big things that the company I'm working for now, they were like, don't tell the nurses that you work from home. Please do not tell them that, because the hospital wants to keep their nurses. But there is one hospital that might be doing it right. St. Luke's, they have virtual nursing, but they have it with a bedside requirement. So the nurse has to work at least a shift at the bedside to be able to work virtually. I was like, that might be interesting, because getting through your week, those 3 shifts in a row, sometimes it's rough. But knowing that you can take a shift and work it virtually and kind of step back from the work a little bit and then hop back into it the next shift and then have your 4 days off, that might keep nurses at the bedside. I don't know. Would you consider that something that you would do?
Oh yeah. Oh my gosh.
Nursing?
I mean, that's actually really brilliant, because like that would be something that if the hospital systems have some sort of program like that where they've already partnered with a company that would help them get the technology and all that stuff, and help with the workforce too. Like that's, I mean, if I put in my shoes, like, I was burned out by like year 2, basically. It's not easy work at the bedside. And like you mentioned too, is, these nurses that have been doing this for like 20, 30 years. I'm like, holy crap, how do you do this? Like it's hard. But yeah, I guarantee that if that was a thing at the hospital I worked for, that I would be there longer. I mean, I think that's a very easy thing to say,
just having that, because the standard or the model that used to work for bedside is just not working anymore. So kudos to the people that created virtual nursing. I really wish I would have thought of it first, because it is so fire. I mean, the workflow, I mean, what really got me about virtual nursing was when they told us we could do the sign-offs, the sign-off for the people that's listening and don't know. There's certain drugs and medication in the hospital that have to be verified by 2 nurses. So for example, blood, heparin, some places insulin, some places electrolytes. And when you're working at the bedside, sometimes your friends, if you're running around, your coworkers are running around too. And that kind of stops up the workflow. You're sitting there waiting for somebody to come sign off with you. Because the unit is just, the workload is so heavy. But really opening it up to have that virtual nurse, letting them know, hey, I'm coming to sign off, or I need to sign off in room so-and-so. Like the other day, I signed off on some FFPs for a patient that had an elevated INR. She called me. She was like, hey, can you meet me in room so-and-so? And I was like, yeah. Went in there. I switched the camera so I could see what the bag was reading. I read what was on the patient's armband, and I read what was on the bag. And then I was able to remote into her EMR and put my credentials in there to say that we signed off. She was done. She hung the infusion. She got the vital signs and she watched the patient and everything. But like, it was able to like keep that workflow going. It didn't get clogged up because she was waiting for somebody else, because the workload on the unit is so demanding and the patients are very heavy. And when I say heavy, I mean the patient workload is heavy, not like the actual patient. But I was like, that is awesome. And most of the time, virtual nurses are RNs because of that, because we do have to sign off on certain things. I had a lot of LPNs ask me if they can do this. Not yet. I wouldn't say LPNs wouldn't be able to do it at all, but as far as I know, it's only reserved for RNs. But virtual nursing is cool.
Yeah, that makes sense. And I mean, I can't even count how many times I've, especially if you have PPE in the room and you walk in there and then like 2 seconds you're like, oh, I have to get this signed off. And then you freaking waiting for like, like 10 minutes, just you're like looking outside the room, like anybody here to help sign this off? I mean, those little things, I mean, especially new nurses, they don't, when they go into the field, like they're, naturally most people are like task oriented, like what we see with our new nurses that go through our programs. They're task oriented because they have to get comfortable in their own skin, like trying to make these decisions on the fly and everything. And they don't realize that there is so much little administrative, you can call it, work that is involved with the bedside, that like whether it's literally getting a sign off, like 10 minutes, you don't have 10 minutes
No,
like
you
half the
don't.
time. I mean, that 10 minutes is being taken out of your lunch every time you take a 10-minute little fiasco of like not
Exactly.
doing anything. Like nursing is continuous workflow. You are continuously using your brain the entire time. Like obviously people talk about like physically when you get home from the bedside, you're like, yeah, you're physically tired, but it's more mentally. You just don't even know, like you just sit down and you're like, holy crap. Like you're using your brain, like your entire brain capacity the entire time. Cause like subconsciously, like when you're in one patient's room, you're thinking about the other patients and like what you have to do with them next. And you're trying to tie it in all together. It's like, yeah, you don't have 10 minutes to waste at the
No,
bedside. And like
you
virtual
don't.
nursing, I'm like a complete advocate for it. I mean, I really hope this takes off because I mean, it's going to save. I mean, I think it's a huge factor in the, they all talk about 2030 about this is the projection of like where the bedside shortage is going to go. And the numbers don't look great at all. And I think this is going to be a huge factor into actually preventing that, because the nurses who are like, I am done with the bedside. I'm either like, I'm going to work from home for an insurance company. And then those, that's like a completely highly competitive thing. And also a lot of people that I know that actually did that are not happy with it. And a lot of people who leave the bedside too are always afraid of losing their clinical skills. Well, virtual nursing is the perfect thing because you're still critically thinking. You're basically working in the hospital, but not like doing the hands-on stuff that was, you're not having everything thrown on your shoulders. And your job is to help nurses, which you have to be at least passionate about if you're a nurse, because you understand, you've been in the shoes, you know how hard the job is, you deserve thousands of rewards for doing it. And if you're a nurse who basically your job is, of course, yes, it's patient centered. You're supposed to help with patient outcomes, but really your job as a virtual nurse, it sounds to me right now, you can, clarify this if I'm wrong, but it's like your job is really, you're helping nurses more than the patients probably. But of course that nurse's motive is to help the patient. So you're indirectly helping the patient. So, I don't know. I think it's really cool because I share that, passion of like, I really want to help with the nursing turnover, because like I've just seen so many people go in and out of nursing and it's sad.
Yeah, it is. And that's like virtual nursing, like as far as when I'm working on the floor with the nurses, I only talk to the nurses. I don't talk to any providers. I might call the pharmacy on discharge about a medication, but we're solely there for the nurses. Anything that they need that we can do virtually, even calling down to help with a patient's meal tray. Like, oh, Mr. Johnson didn't get his tray. Can you call down and make sure, like, just taking that mental task off of them, like it makes that's such a big deal. And to turn back to your point about the administrative task and the burden, like just knowing, like, for example, getting an admission. Okay, I think all the nurses, I don't know if I get this wrong, but for the admission, the thing we hate the worst is all them questions we have to ask the patient. Like, I mean, that's like 30 minutes that you're in there asking those questions. And that doesn't even include, like, if the patient is decompensating on the transfer, they coming up from the ED, they need all these cares, like they need their medications passed, they're on a certain drip that needs to be maintained. Like, that doesn't even include that time. This is just you asking the questions. But what the virtual nurse does, they offload that, like the admission process as far as asking the questions, that's solely for the virtual nurse. Like, I can sit, it takes me about 30 minutes to do an admission, and if we get maybe 5 or 6, 7 of those on the unit, like, I mean, that's probably like 3 hours worth of admission time that the nurses can go, like you said, take a lunch or like get off work earlier, get ready for shift report. Like, that's time saved. In my opinion. Now, have been some drawbacks about virtual nursing. While we think it's great, well, I still think it's great. I don't care. I think it's awesome. There has been like some concerns around like what happens to the ratio of the nurses that are on the floor with this virtual resource nurse, right? Do those ratios increase? Like, what would the workload look like? And as far as I've seen, the ratios have been the same. Like, the virtual nurses, we're not even on the staffing sheet. Like, it's just like you're assigned this unit today, and you can see all the nurses that you're working with, and you can see how many patients they have. And so far, it has stayed the same. So hopefully it'll remain the same. And if the ratios increase, that just kind of, to me, defeats the purpose of virtual nursing. I don't know. But I guess I was saying that to say that, like, virtual nursing is coming and it's here to stay. And I feel like as it grows, like nurses have to be more educated on it and know that it's an option before they just stop being a nurse. Now, I will say this, all virtual nurses don't work from home. At the company I'm at, they have like a work from home group. So we're the work from home group. And then of course there's the nurses that work on site. And on site is like a hub. Like you're not actually in the hospital still, you're just like in a building with other nurses working working as virtual nurses. Which is okay. Like some of those nurses, they really like it. They like, even though they're not working from home, they still like the fact they can still do virtual nursing in that capacity. So yeah, virtual nursing can be delivered in a lot of different ways. I prefer to work from home because it's just better. I prefer to work from home. But yeah, the virtual nurse is such a powerful tool. And to me, it just goes to show how powerful the nurse is, because they didn't come out with virtual doctors to assist doctors at the bedside, or virtual pharmacists to assist at the bedside. No, virtual, like nursing is the center of everything we do in the hospital. And having just that virtual resource to pull everything together, that just shows how strong the work of the nurse is. Like, I don't know. I just really appreciate it. I don't know.
Yeah. I mean, what the whole idea of virtual nursing is amazing. And like I said, I think it's going to be a huge factor into like actually literally saving a portion of the nurses that are not going to be working nursing no matter what anyways. But then they found something like this, which is why I believe it's so important that, someone like you who is like advocating for educating, because, the fear of what you already mentioned earlier is, they're fearful that all the nurses are going to start leaving the bedside and go to virtual nursing. Well, I mean, the truth is there's nurses out there that love the bedside. I mean, there's nurses that couldn't imagine being outside the bedside. I have many friends that are just like, I love being a nurse here. I mean, it just depends. And I don't think that's a fear that they should actually have. It's that the virtual nursing is something that needs to happen, because the more virtual nurses you have, the more sustainable the job actually is at the bedside. Because the reason why people are leaving the bedside in the first place is because it's not a sustainable work environment for a lot of hospital systems. They're not supported. And nurses are wearing like thousands of hats every day. They're an electrician, they're a cafeteria worker, they're this or that. They're like, they do like all kinds of stuff that shouldn't even be in their tasks for the day. And like taking, like you said, like literally the 10-minute time you're waiting for someone to literally sign off on a medication, or doing an admission. Like like one of my most annoying things I hated at the bedside was doing admissions. Okay. Honestly, no one likes doing admissions. I've never really actually found a nurse who actually likes doing admissions. Because I mean, I guess it depends on the patient, but like there's so much administrative stuff, as you mentioned, all the questions you have to ask. It takes at minimum 30 minutes. And now that's if the patient doesn't say a single word to you outside of answering your questions, because there's always something else too. You have to update the family. You have to get all the supplies in the room to prepare. You have to, of course, monitor the patient, get their medications into the medication list. You have to verify the medications in the medication list. You talk to the pharmacist to verify those medications. I'm just like thinking of all the stuff I used to like.
Right.
Like way more than that people don't realize.
Yeah, that's not even half of it.
Yeah, it's like even a quarter.
I really appreciate, like, because I used to think about this every time before I even knew virtual nursing. I was working at the bedside. I was like, somebody really needs to look at the day of the nurse when they clock in to the time they clock out. Because I would say to myself, it's kind of ridiculous the amount of tasks. It was kind of unrealistic for me to sit there and think I could do all that in 12 hours. Because I was like, it's just no way. Like, and I would beat myself up about it. But the more I went through it, I was like, it's just too much stuff. And then when I found out about virtual nursing, I was like, so my full-time job is to take the workload y'all assigned to one person, take that workload, and now it's my full-time job that I do for 12 hours. That's how you know you had too much work. If that can be my full-time job now, I'm like, so I was
you're
right.
Spending all 12 hours on it.
Exactly.
And just think about the quality too that gets, because you know what gets sacrificed? It's the quality of the documentation. It's the quality of that goes towards the patient. So not only is this, I can see people who are outside of healthcare have absolutely no idea what nurses do. They think nurses just wipe butts all day. They're probably looking at this and being like, oh, here we go again. Nurses complaining about their job.
Exactly.
And they're just like, oh, this here they go. They're just being lazy. They want to work from home and not actually provide good patient care or something like that. I've heard so many ignorant things like that, but it's like you said, like what gets sacrificed is the patient care, and what nurses are truly like. There's obviously nurses in there that are there for the money, like selfishly. No one's perfect. Like there's not going to be, just like how there's cops, there's good cops, there's bad cops, there's good nurses, there's bad nurses. But most of the good nurses, they're there to actually, because they actually care. And it's like if there is a piece of them that actually like enjoy, like I said, doing bedside work because they really love providing care to people in like a very desperate moment in their life. And they're making that moment just a little bit better, or like, literally saving lives. So like, it's just like being at the bedside, you're doing that, but like there's no support and you're doing all these administrative tasks that takes you away from giving good patient care. So this virtual nurse is allowing better delivery of healthcare as well. So that's my point with that. But I guess a lot of people going off that point is, what is the typical day in the life for you since you're at home? Like, what is your schedule look like? So like run through like the whole, like, I start work at this time. This is usually what I get assigned, or this is like the typical day in the morning. What is it? And, do you get like a actual break? Do you get like an assigned break from your agency or whoever that is that coordinates that? So what's like the typical day in life for you?
So like I said, I'm a day shift nurse. So I work 7 to 7. We usually huddle around 6:50 just to go over everybody's assignments, because usually you get a buddy virtual nurse that's available, because sometimes the units can get like overwhelmed with admissions and discharges, but you have a virtual or a buddy nurse that you could call on. And then once the night shift nurse comes off, I'll go over through her handoff and see if there's any pending admissions, anybody coming up from the emergency room, or anybody that didn't get discharged yesterday, but we already updated their stuff. They just need to have it reviewed. So we have like a note of all those things. And then I usually get assigned a unit, so a whole set of patients. So I'll be responsible for like maybe 24 patients, somewhere around there. And I will sign in. So usually we use Epic. So I'll sign into the Epic chat and I'll message all the nurses. We'll get a staffing sheet. We'll see all the nurses that are working for the day, and I'll send them a message and let them know I'll be the virtual nurse working with you today. And then usually I'll go through the charts for a little bit. That only takes maybe like 15-20 minutes. And then for the first part of the morning, it's kind of slow, like very slow. It's not too much going on, and rounds don't start until kind of after the nurses do their med pass and everything, so like 10 o'clock. So right when 10 o'clock hits, like that's when the doctor puts in the discharge orders. They start doing their rounds, and then that's when I start making my rounds. Now my rounds consist of like updating the patient on the plan of care. We'll do pain assessments. And then if I see that the doctor has ordered any new medication or something like that for the patient, I'll go ahead and give them some education on that, because that's also another function of the virtual nurse, to do the education. So as I'm rounding on all the patients, sometimes I'll get orders or I'll get messages that room so-and-so is ready for discharge. So I'll go and I'll look over their after visit summary, the little packet they get. I'll go in and edit it and make sure everything is in there, follow-up appointments, medications, diet order, all that stuff. I'll make sure it's right. And then the bedside nurse, I'll let her know it's ready, and then she'll print it. And then I'll go in there and I'll review everything with the patient on the screen with them. So like I can like share my screen, and they'll have the packet in their hand, and I'll just go through everything. And then I'll make my little discharge note, and I'll keep on rounding. And that usually takes me up until about lunchtime. It kind of slows down a little bit again. But then since in the morning we did all those discharges, my afternoon is filled with like admissions. So then I'll start doing all the admits. I'll start back rounding again. We round like sometimes like 3 times a day. So I'll start back rounding again. And we usually get breaks. We get 2 15s and a 30. But sometimes, like I said, like in the morning time from like 7 to like 10 o'clock, it's very slow. Sometimes I might get called for a sign off or a skin check, but other than that, it's not really much to do. I don't know how to put it. It's not much to do until 10 a.m. when the doctors start doing their rounds and doing all that. And then, so I'll do all that. And I personally don't feel like I'm being micromanaged, because virtual nursing, well, even bedside nursing, it's one of those things like when the admission comes to the floor, you don't have to do it right away. Like you can just like do some of your other tasks. If the patient's unavailable, it's okay. You can come back to them. The discharge, they kind of want that done right away because they're trying to get patients in and out.
Right.
And then the rounds, like that's not something that has to be done like on the hour. It's just if the patient's available, there's nobody in the room, you're doing your check-ins with them, like just doing their safety checks. So it's very much like I'm in control of my schedule for today. I do it at the times that I think I need to do it or it should be done. I do it in a timely manner. And then that'll take me all the way up until 7 o'clock. I'll do my little handoff. I'll let the night shift nurse know what's going on the unit, if there's any new admissions, and there's always new admissions in the emergency room. When I'm leaving, it's like all the admits also come up during shift change. So I'll let them know that, and then that's really my shift. Like it's it's low stress, very low stress. I think the most exciting thing we do are the sign-offs. The patients either mess with the virtual nurse or they don't, like as far as like the technology and everything. The nurses do use us a lot throughout the day. But yeah, I really like it. It's very, well, for me anyway, I can pace myself. Like I'm not stuck at the computer all day without you.
Yeah.
But that's really virtual nursing.
It's so nice because one thing I do want to highlight too that you mentioned like in the very beginning is that you work 3 days a week, 12-hour shifts. And like so many nurses love that schedule. And that's part of the reason why they like bedside so much too, is because like, I don't want to lose that. Because it is super nice. Like, yeah, 3 days you can deal with like whatever, however bad that shift was, you still have 4 days off to recover.
Exactly.
So that's a good thing for I think a huge push, for virtual nursing or a huge advantage in the competition of the work from home as a nurse. Because if you go work for like an insurance company, it's like you're 9 to 5, doing work from home. But
exactly.
This, you're still like involved at the bedside and you still get the interesting, I'm sure your job's not like super boring. Like I would find like doing like insurance or nursing informatics type stuff is probably extremely boring. At least that's just my opinion, but like obviously there's numbers of people out there that would probably like that. And, but at least you get still some of the, like, you're still involved a little bit with the bedside. And like I said, like for me anyways, knowing that you're also helping nurses, it's just a huge, I don't know, that would be really fun. So I can imagine myself really enjoying that.
Yeah, because like you said earlier, you've been in the shoes, like if I try my best not to call them. Like if I see something and I feel like I can figure out myself or whatever, like for example, like if a mission comes up to the floor, the nurses usually have to call us and let us know. Like, no, you don't have to call me. You don't have to think about calling me. I'm already going into the room. You go ahead and you do something else. Okay, don't. Because I know their phone is going off like 300 times a day with other people calling their phone. And I really only call them if I'm rounding and I'm like, oh, this patient is not responding to me. Like, I don't see any chest rise and fall. Like, that's when it's an emergency, I will call. But other than that, I try not to call them. I think they prefer the text message anyway, or the Epic chat anyway. I'll message them just because I know that phone.
Oh my gosh.
That phone. For me,
it's like instant anger.
That phone is going on. Oh my gosh. From the time I would get to work at 7 a.m, my phone was ringing. It was just ringing. And I'm like,
especially right in the morning. Oh my gosh. That was like, there's so many, there's so many little things that when I think back about when I was working at the bedside, it's just like, it wasn't even the job. It was like the little stuff. And then there was just absolutely no support around it.
Yeah.
Like you have to do everything. And like the calls. Oh my gosh. Like, it's so funny you mentioned that because like from 7 a.m. to like 9 a.m., that's my time to like look through the charts, get the meds ready. Please don't call me. It's like the busiest time of the day. Like it's not.
That's
like,
why you were in the ICU.
Yeah.
I was like
the busiest time of the day.
What? From 7 to 9, I'm running around like med surge. I think that's why I messed up. I started med surge.
Yeah, med surge is rough. Like I got floated a few times in med surge, and I'm going to tell you right now, like there's a reason why they're trying to tell new grads to go to med surge first. Because you can't keep
it is. I mean, it's such heavy work. Like
it's just
like what?
It's like, the number of patients too, because that's
for
me. Like I was in the ER at first, but it's so different because you're like, the patients are coming in and out all the time, but you don't have to be with that person all day. You know, it's not like that responsibility doesn't fall on your shoulders the same if you're like having 6 patients in the med surg unit, because now you have them all day. And, you know, depending on how lucky you got with the assignment, you know, like the people, and, you know, if you have a nurse aide or if you don't have one, like there's so many other external factors, that med surg is not for the weak. And there's nurses that are be working for like 20 years in med surg. I'm like, how in the heck did you do that?
Like, oh my gosh, I know. You said not having a CNA, like that just made me like, I go to work without a CNA, I'm turning right around, because now I have to do all the nursing duties and the CNA duties. Oh my gosh, that happened to me one time, and I was like, never again. We had 11 nurses though, no aides. We had to do
total care and med surg
everything.
should never happen.
Oh my gosh, it's because the unit went to limb loss. Like, so all the patients, they lost a limb, some shape, form, or fashion. So 9 times out of 10, they needed help getting up. So they were like very high assist patients. Like they couldn't really do much by themselves. So they were always on the call bill. No issue of their own. Like they needed our help, but we just didn't have the manpower to do that for every single patient and still do all the nursing responsibilities. I was like, this is so unsafe. I do not like it. I do not like it at all. It was rough.
Yeah, one question I have for you too. I can probably count in the time like maybe like 5 or 6 times that I had shifts where I was just like, I'd be walking out of the hospital and be like, I do not ever want to come back here ever again. It was those types of days where you just completely feel like you got trashed all day, and you'd even like get to like document how you want to, and you know, you're spending hours after you're actually done with patient care still at the hospital. And was there a day for you, like, I don't know if there's like a specific day or if there was like maybe a shift that you can remember that was just like, that totally like opened your eyes to, okay, I need to go figure out something else? Because there was a few times for me, which I always had, even before I went into nursing, I was already planning on being a nurse practitioner, which I was able to do that because that wasn't, my end goal wasn't RN, which, I mean, I, for the most part, liked it, but I just knew before I went into nursing, that wasn't going to be my end goal. But like people like who do have that as their end goal, I don't know if that was yours or not. I don't think we talked about that before, if you were like planning on advancing or not, but was there a day where it was just like, okay, there's something needs to happen. I can't do this anymore. I'm going to go in. And then is that how you fell into virtual nursing?
Yeah, I started nursing. Well, I started my first like hospital nursing job while I was pregnant. And it was when I came back from maternity leave and I started trying to be a nurse and try to be a mom and like just trying to keep myself together. I'm like, oh my gosh, I am exhausted. I was doing days and nights, and I have a couple of shifts because I was a float pool nurse, which was good and bad. But being a float pool nurse, I didn't know where I was going to be at. I didn't know what type of patient I was going to have, what type of nurse I was going to work with. But I did work on ortho trauma, and that unit was kind of like so challenging for me. And I was like, oh my goodness, I was so overwhelmed with like the pain management and all the epidurals and the fall risks. I'm just like, oh my gosh. Like you said, leaving the hospital, I was just like, oh my gosh, what am I doing? Ava, how did you want it to be here so bad? And like every time you get off work, you're just like, I don't want to come back. And it was really my daughter that really pushed me out of the bedside. I was like, I need to find something that's 312s was good, but it was like, I was so tired. I can't come home and take care of my baby. Like, I was like, okay, this is too much for me. I need to find something that's a little bit more low key. And I didn't even know inpatient virtual nursing was a thing. It just kind of like, you know how you apply on so many jobs on Indeed, they start recommending you jobs. That's how I found it. I was like, oh, Indeed smelled my desperation. Like, they were like, here you go. Like, here, just try this. And I was like, okay, I'll give it a try. Absolutely fell in love with it. I did not fully understand the job when I applied. I was like, I'm doing what all day? Like, for the patients, even in the job interview, they're like, oh, this is what we do. And I was like, oh, okay. Admissions and discharges, that's cool. And then once they started doing the training, I was like, no, this kind of goes deeper than that. Like, even though that's the main job, like it goes a little bit further. And I was like, oh, I like this. This is fire. This is fire. Other nurses need to be doing it. Boom, NursiConnect. Here we are. So,
it's even.
Yeah,
Go ahead.
I was going to answer your other question. As far as like advancing, I did want to be a CRNA. So I did want to get in the ICU. I tried so hard to get in there. They were like, no, we're going to put you in med-surg first. And I was like, okay. So I feel like I honestly believe if I did not start med-surg first, I might still be on that CRNA track. But med-surg took me out the hospital completely. I'm never working at nobody's hospital. I'm never going to say never because you never know what happened. But the chances of me going back in the hospital are very, 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 very slim. I don't care how much money it is, what it costs. I don't care. I'm at that point. It only took me a year to get to that point. So I was like, I'm not going back. Yeah. But yeah, right now, as far as advancing, they just came out with something, or they're working on something called the Cavern. It's certified acute care virtual nurse. It's a certification that you can get as a virtual nurse. Finally, I've been waiting for a certification like that. And I was like, okay, I'm going to get that. And I'm going to also create my own because nurses always ask me the type of questions you're asking me about inpatient virtual nursing. And what I'm telling you guys is just the surface of it. There's more that goes into it. So I am going to create a course around how to be an inpatient virtual nurse. It's similar to bedside nursing. It's just the technology piece. It's very easy though. It's just the technology piece and then the etiquette that goes around interacting with the patient, all that stuff. But that's something I'm creating for NursiConnect as like a CE course that nurses can get and take and put on their resume and try to get a remote or inpatient virtual nursing job. That's where I'm at right now as far as like advancing.
That's nice. Yeah. Yeah, like once again, what a unique way to use your license because, most people think everything, when most people think about nurses, it has to be at the bedside. And I think schools, they're kind of motivated to, get nurses to thinking about the bedside only, which, I get it, that's where most of the nurses are in numbers, and that's where most of the nurses are definitely needed. But yeah, like I think that's sweet because this profession is only going to grow. Like what you're talking about, inpatient virtual nursing, and then it makes sense to have certifications because it's kind of from what you're describing to me, it is very similar to like if you've worked the bedside, you shouldn't have much of a problem transitioning to a job like you just described.
Very smooth transition, yeah.
Yeah, but then there's also the opportunity for I don't see why this is a bad thing to let new grads do, especially because here we are again with that.
What'd you say? I said, but we'll let them go in the ICU though. It's fine.
Yeah.
It's fine. Everything's fine.
Yeah, I would say like probably ICU. I've been floated to med-surg. I would say ICU, and it's all about like who you are as a person, how you like to work. But I would say ICU is probably easier because you'll have 2 people to worry about instead of 6 or 7, or other hospitals like to really 20. Throw whoever they want at you.
Exactly.
But going back to that, like I don't see how it's a bad thing because I can already see how people are going to push back against this. It's like the older generation of nurses.
Oh yeah,
I can see how this is probably going to be something that's not welcomed at first. Just like how me with my technology, people look at my like Facebook. It has a lot of older people on Facebook. When I post something about VR nursing training on Facebook, they all freak out. They all comment. It's like this is not the same thing. This is not how this should not be like how we should train. Which, virtual reality is never going to replace how you train. It's to supplement and help nurses be more prepared.
Exactly.
So, but people get that wrong. But I can see how it's the same thing with your case.
All the time.
It's good. I'm sure you probably already hear it. Like the older generation nurses, not saying that they're like, just naturally people when they do something for so long, new stuff that comes up like this, they don't necessarily agree with it because, things need to stay the same. But from what we're looking at with the numbers with the nursing shortage, people don't realize how serious it actually is looking.
Yeah.
Like, I don't remember the exact numbers, but 2030, by like the projections they're making, like the bedside is going to be in a pretty severe, like it's already not in a great situation. And by the way, guys, we don't have a nursing shortage. We have a nursing bedside shortage, which tells you what? That people don't want to work at the bedside. And there's enough nurses to supply it. And I'm not saying, like I said, there's people that love the bedside, but there is nothing sustainable at the bedside right now, unless they do what they're supposed to and change up how this should be implemented, how nurses should be treated in the workplace, they need to change the workplace. Well, one of those things that they can help change the workplace is by additionally hiring virtual nurses, like you mentioned. And I think that's a huge push. If anything, out of all the solutions that we have out there, I think inpatient virtual nursing is one of the bigger solutions because we're not relying on these silly robots that are carrying water back and forth to your patient. Oh, great. Thank you. We're spending thousands and thousands of dollars on technology that a machine that walks 2 miles per hour, bringing water back and forth to your patient. I've seen some hospitals doing that. Well, why don't you invest in actually getting virtual nurses? There's plenty of people out there to help you. And I guarantee it that those 300,000 nurses that are not at the bedside would consider a job like you just mentioned. And that would help the nurses that are, wanting to work at the bedside still. And, that's their passion. So, I mean, that's something I would say to somebody who's maybe like, going to push back on that, which I get it. But everything new that gets pushed back on it first.
It does. Like the main pushback is, you can't replace the bedside nurse. Virtual nurses, they can't do everything that the bedside nurse does. Well, duh. Like, we're not there. Like, we're not even on site. How a virtual nurse going to be in a code? We're not. How a virtual nurse going to slide at my patient? We're not. The bedside nurse is still there. And when I say we do the admission assessment on TikTok, oh my gosh. So y'all admit the patient without the nurse being present. How y'all do all the skin assessment, everything? I'm like, the nurse is still there. I see the virtual nurse as like the VA or virtual assistant to the bedside nurse. Whatever they need to be documented, they need somebody called. It's called a family member. You need me to get the advance directive. Like, I can do that. You can do all the physical things, like all of that. But the virtual nurse is just there to do the virtual things. No, it just go over people's head like that. I don't know.
Yeah.
Well, they think the virtual nurse, like, the virtual is the key word.
Yeah. In time, I think people will understand. But the number one complaint that nurses have at the bedside is not having enough time to actually do their job, which is patient care. They have to worry about, like we talked about earlier, charting, waiting 10 minutes just to get a check off.
For real.
Or talking with family members here and there, and talking with doctors, and talking with the PT, and talking with the OT, and talking with speech therapists. And here we go with all the things. Case manager.
All things.
That's hours of work every day. People don't realize that. And like you said, there's a reason why you have a full job or full task ahead of your day, because there's just imagine that's all being put on the same worker who's supposed to be providing patient care. And they can't do that. That's the number one complaint that nurses have about the workplace. So this is the number one solution to that, is what you have is inpatient virtual nursing, because this is taking care of the number one issue. And that is giving nurses back their time to actually provide the care they need to, and safely, by the way.
Yeah.
Because the public should be, there's so much pushback. I hate seeing it, but there's so much pushback, like nurses striking, which, whatever, you can argue like whether they're doing it, they're striking and they're not taking care of patients. That's not necessarily the greatest look, right? They're striking against the hospital. But at the same time, sometimes there has to be movements like that, because these nurses are seeing exactly what's happening to their people in their communities. And it's negligence a lot of the time.
Yeah. And then we're responsible for that as well. So,
exactly. And then we're the ones, we're the ones being pushed into, we hear these cases like the nurse who gave vecuronium when it should have been Versed. These are the types of reasons, not say, okay, that case, whatever, that has to be looked into. But this is an example of like the first impression of that was what she was overwhelmed
the system.
And that's just the number one thing is we need to give nurses back their time, because not only is the nurses at risk for just the turnover is terrible, people are at risk. My child, who's 6 years old, could go to the hospital, and I would want them to go to a hospital that has more nurses. That's the number one statistic that is going to either be a good hospital or a bad hospital.
Yeah.
Nurses are the delivery of healthcare. I'm like talking to people who are like have no idea about healthcare.
Yeah.
They watch Grey's Anatomy and they think doctors do everything.
They really don't, though. What really surprised me was one time the doctor asked me to give one of my patients Dilaudid, and I was a new nurse, so I asked him, I was like, why you can't do it? Like, I'm about to do something else. And he was like, see, I can only order. And he said, but I cannot administer. I said, for real? He was like, yeah. I was like, that's wild. I said, you can order as many medications as you want. He was like, yeah, but I can't take them out the Pyxis, like, or the Omnicell, whichever one it is, like you guys do. Like, I don't even have access to that. I was like, yo, so you have to depend on me for everything? Like, I didn't know that. I had no idea they could only order and not administer. Had no idea.
Yeah, it's so interesting you mentioned that, because like when I was going through nursing school, like I really don't feel like there's a lot of, it's really hard to actually put your foot on like what exactly nurses do. Like even when you're in nursing school, like you're learning the content, like the pathophysiology, all that stuff. But even when you go to clinicals, you're not quite sure, like you don't get to see like the full, you don't step in the shoes of being the nurse and then figuring out like everything you do. You're watching the task oriented stuff, which is what kind of the foundation. But yeah, like even after I graduated, I was like, like what do we make? Like we're learning like what doctors, why they make their decisions, because we're their last defense. We need to know why. This medication appropriate for this patient? Well, it's on us if we give it, no matter what. If the doctor method or that for somebody else, so we need to know to understand every medication that's being given too. But just going back on that is just doctors, of course, are, I would say, the pinnacle of healthcare, obviously, because they make all the decisions. They need to have the medical knowledge, but you can't have a doctor without a nurse. The doctor is not, there's the decision making, and then there's the delivery. The doctor orders, so you order your, let's think of it like Amazon order. You order your package, so the doctor orders the package for you. This is what you need, okay? But the delivery driver is the nurse. Now, if you have a terrible delivery driver, has absolutely no idea where they're going, or they're just, like if they're FedEx, where they slam your package down on your doorstep and completely ruin it, then your doctor's order is not going to be correctly given. And then there you go. There's your medical error. Number one killer in hospitals right now is medical errors. So I think I've been trying to put that message out there for so many people, like especially who are not in healthcare, and even for the new nurses, is that the nurses are the pinnacle, or like the number one statistic on how safe a hospital is. I'm going to take my kid to a hospital that has more support for the nurses than I would saying for the doctors. The doctors, of course, are in terrible healthcare environments too. Now, I don't know the specifics to that, but I do know the specifics to nursing. So that's why I stay in my lane with that. But you can have great orders all you want, but if they're not delivered correctly, then you're not going to have good healthcare. So I do, like, this is going to bring awareness. I think indirectly, I think inpatient virtual nursing is going to bring awareness to that, because then there's going to be an outrage once it's finally like completely, like, you can say commercialized, where it's like a huge thing now, like every hospital has it. There's going to be people like, oh, why can't these nurses just work at the bedside? It's
always going to be something. It's always
going to be something, but hopefully it kind of spreads awareness to like how healthcare actually works, because that's what really the problem is. People don't know until they actually get in the hospital. Because from what I see is like most people who actually do get out of the hospital, recover from some sort of illness or injury, they're always saying the nurses were the most important thing.
The nurses.
The doctors are in your room for maybe 5 minutes a day, depending on how sick you are.
Maybe.
And then the nurses are there with you 24 hours a day.
Around the clock, the clock. Yeah, so
nursing, that's my rant.
It's powerful. Nursing is very powerful. And like you said, you can't have a doctor without a nurse, but you can have a nurse without a doctor. Just know that, okay? You can have without a doctor. That's how powerful nursing is. And I enjoy the profession. I enjoy working from home. Even though I didn't enjoy bedside, I enjoyed the experience because it led me to this. And it led us to being here in this moment. So I can't just say I hate bedside completely, but me going back is a no. But it led me to this moment in this space. So I really appreciate it for that. And I don't know. Do you have any closing thoughts?
No, it's super exciting. I'm definitely excited to watch your business grow too, because it's just going to be a huge push. And I hope that I see you, like, I'm knowing you now in the early stages. I hope I see you, like, when this all becomes a huge thing, that you're going to be like the
I
spokesperson
know.
for it all.
I'm not even ready
So
for it all. But
because what makes it even better is you're a nurse. So
yes.
same thing with my company too, is that we have competitors that do virtual reality simulations, but none of them are actually nursing founders. They're technology people.
Hey.
So nurses know best for nurses, and
They
that's
do.
that's
They
fact.
do.
That's
We
why
know
we,
what's up. We know
yeah,
we've been it. We've lived it. We went through the training. Like you got all the letters behind your name. I got all the letters. Like we know this stuff better than anybody that can sell you anything. Okay. Nurses know. Okay.
yeah.
But yeah, I thought being a nurse wasn't a big deal in like staffing and recruiting, but it kind of is. It kind of is. I was like, Mom, she was like, hey, we need to tell people you're a nurse. I was like, Mom, not really. Like, it don't matter that I'm a nurse. But no, it kind of does. They're like, oh, so you know this. I'm like, yeah, I do. Because they make me do it all the time in the hospital. Or I do it right now, working as an inpatient virtual nurse. Oh, so what are your thoughts on this? Like right now, I'm reviewing a telehealth course for one of the companies I'm courting to do business with. And they were just happy to have the expertise of another nurse to the point they're like, oh, can you look over this for us? So nurse entrepreneurs, y'all starting something, put your BSN, RN, LPN,
Yeah.
MP, put it big on whatever it is you're doing. That was my big mistake. I was like, nobody cares that I'm a nurse. Like, it's a staffing agency. They don't give a they do. They really, they do care. So nurse entrepreneurs, keep that in mind. I don't know why I just try to push that to the wayside, but it's important. Nurse.
I mean, I think it's, yeah, people, well, one reason I think, well, I know we have to close up, but one of the things is, I feel like, I think it is kind of funny because nurses do have the reputation of putting like word salad behind their name. Like it's like RN,
They
BSN,
do.
CCRNC, like whatever it is.
Word salad.
But like really, like, I guess this is my closing thought, since I talk to new nurses all the time, is that new nurses always feel like they have to prove themselves, and like they have to earn their stay at a hospital, or do something amazing or whatever, or they have to know everything before they actually start. Well, like, that's something you just need to, my piece of advice, because we train new nurses all the time, and of course we're involved in nursing students. We see how it goes and how the transition to practice is really terrible, even if you're in a residency program. Is that once you pass that NCLEX and you have the RN behind your name, you are already valuable. You don't have to prove yourself. You are smart enough. You are capable of doing anything and going anywhere. So don't be telling, if you don't want to work in med surge, don't be pushed to med surge. Spend your time, slow down. Don't take the first job that comes to you, because most of the time that first job that comes to you is a very terrible environment. There's a reason why they're fast to you. So be suspicious, be paranoid a little bit when you come out, because it is your life. And just because you're a nurse, it's not your, just because you're a nurse, it doesn't mean your whole life now has to be nursing. Most of my life is spent outside of bedside, even when I was working at bedside. Like, that's my job. Don't treat it like it's your life. It's a career choice. And I see so many new nurses, like, that's their identity, is like, I'm a nurse. But then they don't actually even, at the same time, they don't feel pride. They don't have pride that they are a nurse. They think that when they're a new nurse, they think they have to prove themselves, or like they have to know everything. So what I would say is to slow down when you get your RN. Really think about it. Like, do your research about the hospital that's offering you a job. Pick the best place that is going to support you, not what's going to best look on your resume at first. Don't prioritize anything else other than make sure you choose a job that's going to support you and keep you happy. That's what I have.
All right, Will. Well, can you tell the people where they can find you at, where they can find you on social media?
Yeah, so we are known as Coursetta Nursing on social medias. So it's like course and then TA. So course, TA, Coursetta Nursing. So on TikTok, Instagram, Facebook, YouTube. TikTok and YouTube is our highest engaged one. So if you guys want to watch us there, we do courses for nursing students. So making every topic easier for you. So, learning about diabetes and, what you need to know for your nursing school exams and NCLEX. So we do individual support and tutoring for that. We have a membership tutoring program that you get to actually connect with actual nursing educators. So it's not just an application you're interacting with and all the notes and all the videos. You're actually interacting with a human being and helping you get prepared for your next exam. And with that is our virtual reality. So it's extremely innovative. Not everybody has a headset yet, but eventually everyone will. So you can find me on Coursera Nursing, and our actual company name is Tactile VR. So our website, you can find us on tactilevr.com, and you can look through everything there. So that's where you guys can find us if you're interested.
I will put all of Will's information linked in the description where you can find him, all his social media links. Again, my name is Ava. I'm the Chief Executive and founder of the remote nurse staffing agency, NursiConnect. You can learn more about our staffing agency by clicking on NursiConnect.com, linked in the show notes. Again, thank you so much for tuning in and listening, you guys. We'll see you in the next one.